Hello, everyone. My name is Christina Nguyen, and I use she and her pronouns, and I'm the ACLU of Oregon's Membership Engagement Officer. Thank you for joining us for an important conversation about how we can vote to protect rights for all Oregonians in this election. This event is being recorded and will be available on our website tomorrow. Please feel free to share this important information with your friends and family. I want to start off by thanking our captioner, Elena Kernevig from LNS Captioning, and our ASL interpreter, Brandon Heaps. If you prefer to have the interpreter's window large and the rest of the participants' windows much smaller, you can use the pin feature to keep one window larger than the rest. We invite you to ask questions throughout this webinar, and to do so, type your question in the Q&A box and not the chat box. The Q&A box is located at the bottom of your screen and it has the letter Q on it. And if you would like ASL interpretation to ask a question, please let us know by sending a question, the message in the chat box. And before we dive in, I'd like to ground us all in group agreements. By participating today, it is our expectation that you create a space which values and respects differences of race, ethnicity, immigration status, age, gender, sexual orientation, gender identity, religion, ability, and socioeconomic circumstance. We each will respect and contribute to the ACLU's culture of belonging by fostering an equitable and inclusive experience in all aspects of community work by centering BIPOC voices and experiences. This will look like listening to understand by making space and prioritizing oppressed voices, speaking my truth responsibly by taking responsibility for your impact regardless of your intent, and for white people and other privileged identities to not put the burden on BIPOC and other oppressed groups to educate you about the harm that you've caused. And being willing to do things differently and experience discomfort, and seeing the discomfort as an intention, as an opportunity to grow, not a barrier to it. Thank you for your willingness to be here with us and honoring this space. Now let's talk about how we can vote to advance rights for all Oregonians in this upcoming election. In this hour together, we will discuss Measure 110 and how you can get engaged in that important campaign to save lives. We'll give you a quick recap on other ballot measure recommendations and also cover how you can be best prepared to vote in the upcoming election. And for those who have already voted, we'll share a couple of great opportunities to get engaged and mobilize voters nationwide. To kick us off, I'm excited to have Bobby Bird and Sammy Alloy from Measure 110 to join us today. Please enjoy this video about Bobby and his experience.
My name is Bobby Bird. I'm an Oregonian. I'm a grandfather. I'm a father. I love my kids. I've been clean since '93, but 2.5 decades ago, I was arrested for a small possession of drugs. The one police officer went over and got some drugs out of the bushes. They tell me it's mine. In the courthouses, the only thing I could understand was you could take a plea. So I took the 3 years probation, thinking, okay, do the 3 years probation, pay the court costs, pay all your fines, you should be done. That wasn't the case. This has followed me for over 2.5 decades. It's kept me from getting housing, apartments, getting places near my kids. Now I have to travel 3 hours to go see them. I got a promotion at Intel, got my own little kitchen to cook breakfast kitchen. They do a background check, and next thing you know, I'm getting escorted out the door because of that drug incident. It makes me feel like I'm trapped, like somebody owns me or something. So we need to stop ruining lives and start funding recovery and treatment. Now, if we all come together, we can make this work.
Alrighty, I'd like to welcome Bobby and Sammy from the Measure 110 campaign.
Thanks so much for having us.
Yeah, thank you for joining us. Well, I'd love to start off with Bobby. Bobby, can you start off by introducing yourself and sharing why Measure 110 is important to you and why Oregonians need better access to drug addiction treatment and recovery?
Yes, I'll start off by telling you a little bit about my story, about myself. So hello everyone. My name is Bobby Bird. I am a community organizer on the staff of Measure 110. I've been encouraged by the increased support of the Black Lives Matter movement. Unfortunately, our racist drug laws and over policing policies have hindered my life as a Black man. 27 years ago, I was arrested for a small amount of drugs. I thank God that I didn't lose my life like so many Black people have, like Breonna Taylor, George Floyd. I realized every police encounter possesses a threat for Black people. Um, and this may be hard for you to understand unless you've lived it or walked in my shoes. But after talking to some of my white friends, I realized that I've been pulled over more times in 1 month than most of them have been pulled over in their whole entire lives. Drugs are the biggest excuse for police to arrest Black people. Every day I had to live with the fear of leaving my house just to do everyday things like go to the grocery store, the gas station, or restaurant. And that fear was that I might not come back home to my family, that I might get put in jail or beaten up or maybe even killed. But even though I've been clean since 1993, that conviction has followed me all my life, hurting my ability to provide for my family. I decided to dedicate my life to my son and my daughter. But losing employment opportunities more than 2.5 decades ago caused me tremendous pain and hurt the lives of my innocent children. So just know this, our current drug laws are indeed the new Jim Crow. And by passing Measure 110, Oregonians has the opportunity to chip away at our broken system. A no vote is a vote on our current racist drug laws. So to stand by in silence or the so-called be neutral is just like voting no. This means you're all right with our current racist system. But a yes vote is a vote for the right side of history. And Oregonians have a moral obligation to do the right thing. And I encourage all Oregonians to do the right thing and vote yes on Measure 110, because I know I will be. This is not something that, it does not legalize drugs. And we need people across the map in Oregon here to come together and make this first step and make it happen right now.
Thanks, Bobby. I appreciate your vulnerability and for sharing that with us today and for your great work for Oregonians. And Sammy, I'd like to pass it to you to introduce yourself, share why Measure 110 is important to you and what this act does.
Thank you so much, Christina, and thank you so much for sharing your story, Bobby. My name is Sammy Alloy. I use she and her pronouns, and I am the Deputy Campaign Manager for Yes on Measure 110. And, I've worked in Oregon's progressive and racial justice movement for a long time, but this issue is particularly near and dear to my heart because I grew up in a family with a lot of people who were experiencing addiction and who were criminalized for that addiction. And it was destabilizing. It created trauma for my family. It drained, middle-class stability from my family, and it didn't help anyone get better. No one, that in my family's experience received treatment for their addiction in the carceral system. And I think it's so important that we acknowledge that this approach has failed and we shift to a health and dignity-based approach that will save lives. So, I'm super excited to have this opportunity to work with so many Oregonians in our broad coalition for Yes on Measure 110. Oregon right now is experiencing an addiction crisis. We are nearly last in the nation in terms of access to substance use disorder treatment and recovery services for those who are ready to get help. But we're one of the highest in the nation in terms of access. Rates of substance use disorder. We have nearly 1 in 10 Oregonians over the age of 12 suffering from substance use disorder, and we lose 1 to 2 Oregonians every day in a preventable overdose death. So, and those overdose rates have only continued to spike in the last year, and particularly as people are experiencing isolation because of COVID. So, it's time to shift to a more humane and effective health-based approach. So what Measure 110 does is it shifts us from currently we're arresting nearly 9,000 people a year for low-level possession of the smallest amounts of drugs. That's about 1 person per hour. And Measure 110 instead creates an infusion of funding into desperately needed treatment and recovery services. It does not legalize any drugs, but it reduces criminal penalties on possession of the lowest level amounts of drugs. So the measure will direct funding between about $100 and $150 million a year to a treatment and recovery fund under the Oregon Health Authority. And that funding will be invested in sort of 2 things. One will be a network of addiction recovery centers around the state that will be available for people to come to get their needs triaged, assessed by a healthcare provider, and some casework and a warm handoff to the appropriate services for them in their community. The other sort of avenue of the funding will be a grants program to expand access to these services through investing in existing providers who are providing low barrier, trauma-informed, culturally responsive, evidence-based care in the areas of drug treatment, peer-supported recovery, harm reduction services like naloxone, syringe exchanges, et cetera, and housing services for folks. And what the other part of the measure does is that it moves our current drug laws around the possession of the lowest level amounts of drugs from currently a Class C misdemeanor to a Class E civil violation. So instead of getting a criminal record like Bobby experienced that can set up lifelong barriers to accessing basic needs like housing, jobs, professional licenses, and immigration status, people would not get a criminal record for that offense. They would get something more similar to a traffic citation and a $100 fine, which they could easily waive by accessing a cost-free assessment at one of the addiction resource centers that I mentioned earlier. So, we're really shifting from criminalizing folks who are experiencing the disease of addiction to connecting them to vital and life-saving services.
Thanks, Sammy. That really paints a great picture of why this would be a huge win for Oregon. Many of ACLU members, one of their top issue areas that they're concerned about is criminal justice. And I'm wondering if, Bobby, if you could tell us about what decriminalization means.
Okay, so decriminalization does not legalize any drugs. It was just like Sammy just said, it will still be against the law to possess drugs. It just means reducing the harsh criminal consequences for small amounts of drugs. So instead of getting a criminal record for that follows you for the rest of your life, like what happened to me, you can get connected to services so that you can get the help you need. And I think that's a better way to go. I don't want anyone else to have to go through what I went through. So I think it's a good move. I think it's the best move for us.
I agree. I think that would be wonderful. And would you say that our current drug laws are implemented in an equitable way?
No, no. Our current drug laws are flawed and racist, and they were designed to be that way. And they are indeed the new Jim Crow. That's why Black people have been consistently arrested at a higher rate than everyone else. even though we all basically use drugs at about the same rate, you know, but this is morally wrong. And our criminal justice system should be fair and just for everyone, no matter what color your skin is, you know. So, and so that, I mean, I really feel that way.
Thanks for sharing that. And for those who are just tuning in, feel free to drop questions into the Q&A box at the bottom of your screen. It'll say Q&A on the box, so you can join in and ask Sammy and Bobby what questions might be on your mind. But while you do that, I'm going to toss some nitty-gritty questions to Sammy. Sammy, can you tell us who will be able to get treatment, and these services will be available to all parts of Oregon?
Yeah, that's so important, Christina. Thanks for asking. So, right now, Oregonians are facing this crisis where they have a friend or family member or loved one who might be experiencing addiction and they don't know where to go. If you have an overdose and you land in the ER, you might get a brochure that tells you, some options to access treatment, and you might be on that treatment waiting list for weeks or months. And we know that we're losing people while they're waiting for treatment. And we know that a lot of people don't know what options they might have to access treatment outside of the criminal justice system. People don't know if their friend or family member can get access to help, short of receiving, these horrible criminal justice involvement, right? So, Measure 110 would establish this network of addiction recovery centers that would be open to all. You can self-refer or get a friend or family member referral. You don't have to come through the criminal justice system. Likewise, the services that will be expanded through the grants program will be open to all, including, if your addiction is alcoholism, which is currently legal. This is not limited to folks who are experiencing substance use that is currently criminalized. This is just creating a low barrier, non-judgmental, trauma-informed space that people can come to access these services and find out what services are available in their community, no matter who you are, what kind of insurance you have, your immigration status, or your criminal background. And it's so important because we know that for a lot of folks who are going through the criminal justice system currently, that 53% of people who go into jail who have the Oregon Health Plan are stripped of their Medicaid. And so we know that that is not an effective way for people to access healthcare and treatment services. So this is going to be a much more accessible way for people to access these services. And the measure does call for the addiction recovery centers to be established across the state. So it calls for at least 16 of these centers, one per existing coordinated care organization service area. So, that's CCOs are super confusing, and the recovery centers are not connected to the CCOs themselves, but Oregon currently has a map of 16 different service areas where the CCOs serve, and these centers will be connected to those so that it guarantees that in some parts of the state where there's currently virtually no recovery services whatsoever, that people will have access to one of these centers. They can be based in existing service providers that could be certified to become one of the centers, or they could be new physical plant. They also include a 24/7 telephone hotline and web portal where people can go to access these assessments and get a warm handoff to services. So we definitely don't want people to have to drive for hours, to access these basic services. And these folks will be on hand to help people navigate the really confusing addiction and recovery system that Oregon currently has.
That's incredible and would really be such a big game changer for Oregon and Oregonians. Before we take some questions from the audience, which feel free to pop them into the Q&A box, other than voting yes, can you tell me what ACLU supporters can do to get involved in the campaign?
Absolutely. Thanks so much for asking. We're less than 2 weeks away from the election, and we know that Oregonians are ready for Measure 110 everyone in the state has a loved one who's been hit by the addiction crisis, and we have a lot of momentum, but we need folks to get involved to help to keep that momentum up, because a lot of folks have voted early, but a lot of undecided voters haven't finished filling out their ballot yet. So one of the best ways that you can get involved is by signing up for a phone or text bank. And the ACLU is going to pop a link into the chat for folks to sign up for this Saturday's shift at 1 p.m. We also have daily shifts that you can access through our website, Vote Yes on 110. You can go there to sign up. If Saturday doesn't work, Vote Yes on 110.org to sign up to volunteer if Saturday doesn't work for you. And of course, you can also donate to help keep our beautiful ads like Bobby's personal story on the air until Election Day. So you can do that at voteyeson110.org.
That's great. And I really hope that all of you in the audience will sign up to Phone Bank right now. The link was just dropped in our chat. Please share it with your friends and family and get involved in this campaign, because it'll change so many lives for Oregonians. And like I said, it'll be a big win for Oregon, and I hope you'll help us do your part in making it happen. So I am going to toss some questions to Sammy and Bobby from the audience. As a reminder, if you have a question, please send it in the Q&A box and not the chat box. Let's start with a question from John. John is wondering, what is the timeline on the act once it passes?
Great question. The first thing that will happen under the act is that right away in January, these offenses will be decriminalized, so that we're gonna, stop feeding this pipeline of mass incarcerating people because of their addiction. Right away, these offenses for possession of a controlled substance for personal use will be moved to a Class E violation. No change will be made in the criminal code for possession with the intent to deliver or more serious drug-related crimes like a DUI. Those offenses will still be handled the same way as they currently are. But we're going to decriminalize these possession offenses right away. And the first thing that will happen in terms of the network of services is that the online portal and the telephone hotline for the addiction recovery centers will get up and running, so that people will have a chance to get their fine waived and get out of the criminal justice system and start getting these referrals to care. There's also, the measure calls for an oversight and accountability council to be seated and appointed by the Oregon Health Authority to help oversee the disbursement of these grant funds. And so, that body is going to actually, I think, really transform our system in terms of how we disperse funding in this way, because it is going to be made up of healthcare providers and impacted community members. It calls for community members who have been disproportionately harmed by the war on drugs, people who have personally experienced substance use disorder, service providers and advocates, and addiction medicine doctors, social workers, et cetera, to be seated on this panel of folks who are going to help implement the measure and help disperse these funds. And so, the process of nominating folks to that committee and getting them seated will begin. We'll go through the legislative session and do some rulemaking on some of the other parts in terms of the service delivery model. And, we have people in our coalition are already doing some work to build a table of advocates who are going to be advocating around the implementation of the measure to make sure that it's implemented in the most equitable way possible, and that there's oversight, accountability, and that these services are really accessible and go to where they're intended and needed, which is to invest in the BIPOC community and to culturally specific service providers and community-facing service providers, so that there's a diversity of services available that are culturally responsive in the community. And the measure is intentionally not overly prescriptive, because we want service providers to be able to be flexible in meeting their clients' needs in a culturally specific and relevant way in their own community. So there will be, we'll have to do some advocacy and rulemaking around those, but we also want to make sure that we're building a really strong table so that people can implement these services in a really flexible way.
Wow, that was really thorough and helpful. Thanks, Sammy. I've got one more technical question for you from Betty. Betty is wondering who decides how the money will be spent and how that's allocated.
Great question, Betty. So it's the Oversight and Accountability Council that I just mentioned that's made up of those service providers and impacted community members. So they will be nominated by advocates and service providers who are already part of our coalition, and they will be appointed by the director of the Oregon Health Authority.
Great. And then I'll throw you one more question from the audience from Nancy. Nancy's wondering about the context of who's behind the Drug Addiction Treatment and Recovering Act and how it was written.
Great question. So the act was written in collaboration with dozens of service providers and community-facing racial justice groups around the state, including the Oregon ACLU. We did a deep process of engagement with treatment and recovery providers, with organizations like the ACLU, Unite Oregon, Partnership for Safety and Justice, Criminal Justice Reform Advocates, the NAACP of Portland and the Coalition of Communities of Color, as well as, we did a lot of communicating with the Oregon Criminal Justice Commission, now District Attorney Mike Schmidt, previously was at the Criminal Justice Commission and gave us some insight into how the current system works. And we sort of created the measure with input and vetting from about 50 of these groups and experts. We also have a robust partnership with the Drug Policy Alliance, who is a national organization and funder who works to improve health, safety, and dignity for people who use drugs.
Great. It's great to hear that so many people are at the table to craft this. I actually lied. I want to throw one more question to you if you're okay with that. Toby's read that currently there's a waiting list to get into recovery centers. So they're wondering, until new centers are built and up and running, what will happen to people after January 1st when people have their free assessment?
Yeah, so I mean, this is part of the problem, right? That people need access to these services, and there does need to be an implementation phase that all ballot measures go through while we're sort of transferring this funding and getting these places up and running. And we wanted the first step to be at least that nobody is continuing to be harmed by offenses that we're making illegal. But yes, we desperately need these services and we need them right away. And that's one of the reasons why we did a ballot measure. The legislature has just not been able to act to make this robust investment that we need. And Measure 110, according to even the most conservative estimates that we have around how much funding will be directed to services, is 4 times what Oregon is currently spending on non-Medicaid expenditures for these services. So unfortunately, there will be a lag time while places are getting up and running, but we know that this is going to be a really huge step. Because of the way the measure is written, a lot of places will not need to be new places will not need to be built. We're investing in existing service providers to expand how many people they're going to be able to accept. So, it's my hope that by routing the funds that way, that it will sort of decrease the lag time, because we won't need to be waiting for new centers to be built all over the state.
Great, Sammy, thanks. It's great to know that capacity will be built, because we all know we desperately need it. That said, I want to thank you and Bobby again for taking the time out of your busy schedules to talk to us about Measure 110. And again, I hope all our audience members will look in the chat, click on that link, and join you all for phone banking on Saturday. So that would be great. So thanks again, Bobby and Sammy, for joining us. We really appreciate the great work you're doing.
Thank you so much. I really appreciate you having us.
Yes, definitely. Thank you so much.
And in addition to a yes vote on 110, the ACLU of Oregon has recommendations on a handful of other ballot measures. I'd like to welcome my colleague Kelly Simon, our interim legal director, to share a speed round of recommendations. For a recap and additional information on these, you can check out our online voter guide that is available on our website, and the link will be dropped in our website. Hey, Kelly, how are you doing today?
I'm doing all right, Christina.
Great.
We got a lot of info to cover, so.
Yes, let's get to it. Can you start us off on why we recommend a yes vote on ballot measure 109 on psilocybin therapy?
Yeah, absolutely. So one of the things that we've seen as a really harmful consequence of the war on drugs has been government interference with exploration of alternative drug therapies that could help people with really debilitating conditions, things like depression and anxiety and addiction. So if approved, Measure 109 would create safety standards for trained facilitators to oversee psilocybin therapy. This therapy would happen in licensed facilities, and the measure would approve licenses for these facilitators, for service center operators, for producers of psilocybin mushrooms and products. The measure does not allow things like retail sales. It doesn't allow home use of psilocybin, and doesn't impact kind of or allow for marketing of any psilocybin products.
Thanks, Kelly. And then the next recommendation is a no vote on ballot measure 107 on campaign finance. Can you share a little bit more?
Yeah, campaign. Oh, I can also just let my phone go off for everyone randomly. Let me see why that's happening really quick. Okay, we made that go away. Sorry about that. So measure 107, campaign finance, we are recommending no on this measure. So let me unpack why. This may be a little bit confusing for folks given some recent work that we've done. So Oregon is one of the few states with, I think one of 4 states with no limits on campaign contributions. We, ACLU of Oregon, changed our policy, a longstanding policy of opposing limits on campaign contributions in 2019, so just last year. We changed our policy in part to acknowledge the undue influence and access to political power that financial wealth gives some people and disproportionately, or excludes others, disproportionately people of color and people living in poverty. So in April of this year, the Oregon Supreme Court overturned some longstanding precedent that was consistent with our old policy, and made limits on campaign contributions now legal in Oregon. We filed an amicus brief in that case, and consistent with our position, campaign contributions are now legal in Oregon. The Oregon legislature had referred this measure, Measure 107, to the ballot prior to that Oregon Supreme Court decision. And we, ACLU of Oregon, believe that we shouldn't amend our constitution, our state constitution, without a really significant need to do so. And now that the court has made that decision, we simply just don't need this measure. We can implement campaign contributions at the local and state level already without this measure. And so therefore, we think this Measure 107 is not needed. We also have some other concerns about the breadth of the language and how that might impact other rights. So we're recommending a no vote on Measure 107.
Sounds great, thanks. So the next 2 ballot measures that we have recommendations for are not statewide, but Kelly, can you share more about our recommendation for a yes vote on Multnomah County's ballot measure 26214, preschool for all?
Yeah, this one's exciting to me. So the ACLU of Oregon believes that every child has the right to a free public education. And that right, the education right, is inextricably linked to participation in our democracy. You know, no child should be denied access to education for any reason, and especially not financial means. So the goal of Preschool for All is to make tuition-free preschool available to all 3 and 4-year-olds in Multnomah County by expanding programs at schools, homes, and through other early education avenues like Head Start.
That really is exciting. And lastly, the ACLU of Oregon recommends a yes vote on Portland ballot measure 26217, which is on policing reform. It's a policing reform charter amendment. Kelly, can you share some more about that?
Yeah, this is a really timely one and a really important one. So Portland currently has a police oversight system, but that system fails to deliver accountability in many ways. But chiefly because the current Independent Police Review Authority doesn't have full independent investigative and enforcement power. To put it simply, when you make a complaint to IPR, they can't always do much about it, even if they agree with you. So Measure 26217 in Portland aligns with longstanding ACLU policy that calls for effective oversight of police to be carried out by an independent civilian review boards that are representative of the communities being policed, and especially the communities being over-policed, and boards that are empowered to investigate, to subpoena testimony, conduct hearings, report findings, as well as recommend policy changes. So Measure 26217 would amend Portland City Charter to establish a framework for a really truly independent police oversight board with teeth, with real authority and dedicated funding to respond to misconduct. We want to acknowledge that the framework created by the measure does have a lot of open questions, including how do we balance police accountability with officers' due process rights? And so building a new system of police oversight will benefit from a lot of transparency and ample time for the public to engage and scrutinize the implementation process. But overall, the passage of this measure is a real opportunity to create a more equitable, just, and effective police oversight system.
Thanks, Kelly. That's really relevant for the for what's happening in Oregon right now. We've got a question from Eric about the campaign finance ballot measure. They're wondering, if we don't amend the Oregon Constitution with respect to campaign contributions, couldn't a future court overturn the recent decision? Wouldn't amending the Constitution prevent that possibility?
That is a possibility that some court someday down the line could always go a different direction. I think at that point, that would be when we might want to think about, okay, what's the language we need? What exactly has the court overturned or changed course on? One of the other things that we didn't quite cover is this language has really broad disclosure language. In our policy, we're very supportive of broad disclosures, but the language isn't limited to things like candidate elections, and it's not limited to for example, expenditures made that aren't even clearly supporting or opposing a candidate. They may just be kind of relevant to politics, and it's this really broad language that I think we would be served best by slowing down and not taking steps right now that are unnecessary, that we're not and not accounting for kind of collateral consequences down the road.
Thanks for answering that, Kelly. So the upcoming 2020 elections are, as we all know, critical. And of course, we're encouraging everyone to vote, and to vote like your rights depend on it, because they do. If you or someone you know needs assistance obtaining a ballot, particularly anyone displaced by fires, experiencing homelessness, or in jail but not convicted, please contact the appropriate county elections office to ensure a ballot is received. You can return your ballot by postage paid mail, but the last day to safely do so is October 27th. And you can also drop off your ballot at an official ballot box up until 8 p.m. on Election Day, Tuesday, November 3rd. Kelly, can you share some tips if people have any concerns about casting their ballot?
Yeah, I think before you cast your ballot, know your rights. So Christina kind of just alluded to some. If you're in jail but you haven't been sentenced yet, you have the right to vote. If you're houseless, you still have the right to vote. If you've been displaced by wildfires, for example, you still have the right to vote. And there are resources out there that we can direct you to, or contact a local county election office if you want more information about how to do that. You also have the right not to be intimidated when you're submitting your vote. And in Oregon, we can often take that for granted because many of us can vote in the safety of our own homes, or those of us with safe homes can do so. But you have the right to fill out your ballot independent of coercion or intimidation. And if you have concerns about that, there's a nonpartisan election protection hotline you can call. You can call your county clerk and file a complaint, things like that. ACLU, I think also we have Know Your Rights information for the chat. Has that been put out? Cool. Yeah, those are some of my tips. Get your ballot in ASAP.
Thanks, Kelly. And for those of you who are eager to support civil rights battles nationwide in this election, head over to People Power, peoplepower.org, which is the ACLU's platform for grassroots action. Over there, you can sign up to join volunteer teams and mobilize and organize communities all across the country in defense of our civil liberties by making phone calls and also sending text messages. So this is a great way to defend our rights nationwide. I hope you'll look into that. And I thank so much, Kelly, today for your time. I want to thank Bobby and Sammy again from Measure 110 for joining us today. Don't forget to sign up to phone bank with Measure 110 this Saturday at 1 p.m. A special thanks to all the folks behind the scenes who made this event run so smoothly, especially to Brandon for interpreting and Elena for captioning. There was a lot of critical information and resources shared today, so please feel free to review and share the recording tomorrow. And before you log off, a survey about your experience will open automatically. Please take a few minutes to let us know how we did, how you can keep engaging you in our work. Thanks for tuning into this webinar. I hope you'll join us again at our upcoming events, including our post-election webinar, State of the Union, on November 12th, and also again in 2021 on March 12th for our Liberty Dinner featuring keynote speaker Nikole Hannah-Jones, the creator of the 1619 Project. Registration and more information is available on our website. Thanks so much again, and happy voting, everyone. Have a great day.